To order at 101. Attention, please.
Well, you have my report in front of you. Our outpatient visits are up. One of the things that have been asked about before.
Scoot that way.
Scoot this way. Was the orthopedic contract. It's finally out and advertised. There were a couple of folks that expressed an interest to me about bidding on that orthopedic contract, and so I've notified them and let them know that it's out. So hopefully, I think it's open for another week or two, and then we can start looking at the bids on that, so that we can keep our orthopedic folks here in Claremore, Tulsa area.
Good.
On April 30th, we installed a new emergency generator at the hospital. The other one, generator that we had, was still working and worked quite well. The week before, we had a power outage of about 7 hours, and it worked well. I think it was the last hurrah for that generator. It was original equipment back in '79 in the hospital, and it was still working. But we got the new one installed on the 30th, and everything's running well. We finished, came up with a final design, in-house concept for remodeling the emergency room with area office, and we have sent that to area office to be put out for bids for design, for architectural design, and they're telling us that their goal is to have it finished and remodeled by summer of 2017. And on June 4th, on Saturday, from 10 a.m. to 2 p.m., last year we had a kids safety fair that went over well. Huge response to that. We're having our second annual kids safety fair. We're in the parking lot of the hospital on that Saturday. So if you're up that way, bring the kids, grandkids, bring them by. We'll have a lot to do that day, and a lot to do and share.
What day is that again?
Saturday, June 4th.
Time?
10 to 2.
All right. Counselor Bezzard?
George, when they do the emergency room, how are we gonna keep the emergency room open? Are we gonna make provisions to do that? I
by the
Okay,
emergency
so
room.
there won't be
There's
agriculture.
a huge space back there that used to be administration.
Yeah.
We're gonna remodel that and then attach it, so the emergency room as it stands right now won't be
Okay.
affected at all.
And then on the advertising for the orthopedic, is that specific to Tulsa, Claremore area, not Oklahoma City area? Is that how that's advertised?
Absolutely.
Thank you.
Any other questions? Looks like you're good. Thank you.
Thank you.
Okay, Miss Connie Davis.
Good afternoon.
Afternoon.
Before I begin my report, if you don't mind, the Zika virus is in the headlines of the news every day, it seems, and I wanted to make you aware of some efforts on our public health department and our efforts to address this issue, this public health issue. And I've asked Dr. David Gann, our medical director of our public health department, to come and share some facts and what the Cherokee Nation is doing to address that. So, Dr. Gann?
Good afternoon.
Good afternoon.
So one of my jobs for Cherokee Nation Public Health is to track chronic diseases, make plans for emergencies, infectious diseases, and I put into your packet just a one-page fact sheet about Zika virus. Our public health department's been working with CDC individually. They've invited us to work with them on our preparedness plans. We've got our liaison at the state health department feeding us information regularly, and we're in the process of completing a 5-stage response plan for the Zika virus. Now, what's most concerning about the Zika virus and why everyone is up in arms, there's really two things that happened. The Zika virus was first found way back in 1947 in a monkey in Rwanda. And a couple of people got sick over the next 70 years. And then suddenly in 2007, there was an outbreak on a small island in the Pacific. About 5,000 people got sick, about 75% of the population. Then it spread to another island. And then in March of 2015, it showed up in Brazil. And in the course of a year, it spread to 33 countries, and about 1.5 million people got sick. And so something happened to either the virus or the mosquito that carried the virus. And that's why we're nervous about what's going on. We've got a long history of epidemic diseases throughout the world, and we kind of know the bad things that can happen as we try to prepare. Now, the second thing that's very concerning is that of the people that get sick, the most vulnerable are unborn children, right? It's pregnant women's babies that are the most vulnerable. Now, because most of the infections haven't occurred in developed countries, we don't have real good scientific data on what's the % chance of this will happen or that will happen. So CDC has people all over South America tracking the disease using really tight scientific methods to figure that out. The state health department has set up a testing plan for the state, which includes Cherokee Nation Health Services, if someone needs to be tested for Zika virus. And that information is in the fact sheet that's gone out to you. So as of now, there have been 4 cases in Oklahoma. They've all been travel associated. So someone left the country, contracted the virus, and brought it back. There have been no cases in the United States of someone getting the virus from a mosquito in the United States. There have been a few cases of sexual transmission, but that came from someone who had traveled outside. And we're just waiting for it to happen because it's going to happen. We don't know how the virus will spread here in the United States. It's a different weather pattern than in South and Central America. So we're preparing. Now, the best way to prevent the virus from spreading is to avoid mosquito bites, right? And it seems kind of silly to stand up here and say that because that's really difficult to do. The basic things coming out of CDC in the state are Stay inside when you can with air conditioning. If you have your windows open, have screens in good repair, and when you go out, use some kind of insect repellent. We know that in rural areas, spraying for mosquitoes, environmental spraying, won't stop the spread of the virus. Might kill some of the mosquitoes, might kill a lot of them, but the ones that live are going to be the ones that are resistant to the spraying, and it won't control the spread of the virus at all. So we're watching all that closely. Information's coming out every day on Zika virus as CDC epidemiologists are tracking things. We're first going to see it most likely in the coast of Texas or in Florida, and it's going to go from there. So there's, like I said, regular information coming out, and we'll keep the council apprised of what's happening.
Do you have any questions for Dr. Gann? Counselor Buzzard?
And you may have said this, but if a traveler comes into the United States, what's the chances of him spreading the disease? I think you said something about it, but I didn't hear.
Yeah, that's what's hard, is that we don't know. So if you start multiplying these percentages. So if 100 people have the virus in their blood and they come to the United States, what's the chance they'll be bitten by a mosquito here, and that mosquito bites someone else?
So we don't know that yet.
Don't know. No, it's, like I said, CDC is tracking that and trying to figure it out. And the numbers are starting to come together, but CDC is not going to say anything unless they're really confident in their data and in their science.
And you said there were 4 cases in Oklahoma,
Yes, sir.
and those are all travelers that have been abroad.
Yes. So what the state is doing when someone tests positive for the virus, they don't quarantine them, but highly educate them on keeping them from getting bitten by mosquitoes here in Oklahoma so it doesn't spread. So,
Thank you, Mr. Chairman.
Any other questions? Thank you.
you're welcome.
Thank you, Dr. Gann.
You're welcome.
Okay, we'll get to the report now. The AMO Health Center in Salina staff held a fundraiser for AMO Kids Camp and raised $700 for their efforts. The Kui Health Center had 201 new or reactivated charts, which just shows the tremendous growth in that clinic. Three Rivers Health Center recognized Employees of the Month, Susan Nelson and Dr. James Baker. And they also hosted, their Pink Pearls group hosted Relay for Life annual kickoff. Wilma P. Mankiller participated in a patient-focused group where they invite patients in and get feedback on their patient experience there at that clinic. At Cherokee Nation Hastings Hospital, they hosted Miss Miranda Mormon, a legislative aide, tribal relations liaison to Congressman Mark Wayne Mullen. And they wanted to take a look at our health system and focus on Hastings and the new joint venture there. The emergency department and urgent care provided care to 6,735 patients during the month of March with a lift without being seen rate of 6%, which is higher than our goal of 3%. Surgical services performed 374 procedures in the month of March. Dental services saw 7,702 patient visits. Of those, 1,193 were emergency exams. Public health nursing provided 447 home visits. Jack Brown in March, had 29 patients. Of those, 19 were males and 10 were females. Dietary services provided instruction and education to 734 patients. We had 345 patient runs through our EMS and 726 participants in our training services. I don't always mention those numbers, but that's a lot of people to teach on CPR, ACLS, and a number of things. Some features, from our Healthy Living program. Sequoyah County Public Health educators are conducting smoking cessation classes at the Redbird Health Center there, and they're from 1 to 2:30 every Wednesday. Hastings Wellness Team hosted a 5K run this past week on May 12th in honor of Hospital Week. Mays and Rogers County served as race directors for SafeNet Color Run in Pryor. Some of you may or may not have seen that on March 5th. They had over 880 participants and raised over $27,000 for victims of domestic abuse. And again, at the AMO Health Center in Salino, beginning a Quit Dip campaign, with the Mays County SWAT teams targeting smokeless tobacco use at baseball and softball parks. I think that'll be an interesting effort to do that, but a good one at that. Contract Health in the month of March processed 9,483 referrals. Of those, 9,353 or 98.6 were approved. Behavioral Health provided care to 2,010 patients. I would direct you to this graph in your report, and it compares patient visits for the last 3 years, 14, 15, and 16. And I'm happy to report that we are seeing more patients now in our health centers, which shows the success finally of the implementation of new electronic health record. And we continue to grow. And if you look at the bottom graph, we're trending over 10,000 new patient visits a year. So we're back to busy. Again, the top diagnosis continues to be hypertension and type 2 diabetes. And actually, I've noticed the last couple of months, hypertension exceeds type 2 diabetes. So maybe we're doing a little better job of controlling our diabetics' blood sugars. We've had some good efforts in our health recruitment office. And on the back page, the summary, I thought would be nice for you guys to see that year-to-date, there's been a total of 16 positions filled in the health facilities, and at Hastings, 8 positions filled. We still have vacancies, 13 in the health centers and 8 at Hastings, but I think that shows a good effort on our recruitment staff. That's a lot of positions to fill in that time. We've had some good visits with docs looking at Stillwell, waiting to hear some follow-up on that. And I heard that Dr. Turner really liked one in particular that we talked to, so we're hoping that will work out. And then we've talked to a couple of others for Salisaw. So I feel like we're making some positive efforts and changes in our recruitment office. I'm really happy about that. That is a summary of my report. I'd be happy to answer any questions.
Do we have any questions for Connie? Counselor Taylor?
Has a generator been installed at the Salina Clinic?
I believe it's been ordered. I don't believe it's installed, but I will check the status of that and send you an
Okay,
email.
last we talked in December, that was a first quarter project, and so now we're in May. So if you could find out what the holdup on that is, I would appreciate it.
Yes, I will. I sure will.
Okay, Counselor Anglin?
Yes, thank you, Madam Chair. Connie, on our health facilities, how many vacancies do we have in those facilities?
Back to that report. Now this is a March report, but the current vacancies in all health facilities is 13.
Okay, so that number right there is all of them?
And to clarify, this vacancy is for physicians, mid-level providers, which are nurse practitioners or physician assistants. It may be pharmacists and some behavioral health staff.
Oh, okay. Okay. Thank you.
Counselor Lay?
Thank you, Madam Chair. Connie, at Nowata, we had a public health educator position that was transferred to Benita, remember way back when, and I don't think they ever gotten filled. Could you check on that for me?
I sure will.
And how about the IDOCs at Coos Good?
I don't recall a status on that. Dr. Grimm?
I do know that I went to the graduation and we hired one of the new students to go up there. That's what they announced at the graduation.
Okay.
Is that he's going to Goodies Good.
Oh, good, thank you.
Good.
I can't really tell you
Thank
his
you,
name,
Chief.
tall boy.
Oh,
I think it was about Dick Lawrence.
Oh, good, good.
thank you.
Okay, Counselor Crinton?
Connie, did we ever get anything as far as, we've talked about it several times, the bill collectors? Had one stop me just yesterday. I know we talked about a letter that could maybe hold the wolves off for a while?
Mr. Hayes and I are still working on something like that. We kicked around a draft that I think I shared with you last month, and there's some things we gotta do internally to get that shored up. So it's still a project that we're working on.
Do you have an assistant?
Yes.
What's her name?
Melinda,
Melinda? Is it just the Cherokee.org
her email?
email?
Yes,
What's her last name?
Cookson, Melinda-Cookson.
Thank you.
Counselor Walking-Stick?
Hey Connie, have you been getting any of my text messages?
No,
Okay, I might have the wrong number for you. In the ER where the pharmacy is, like that's open on Saturdays or whatever, the door doesn't open for the patients. I was trying to get in there and she had to come outside and she had to keep jerking. It's one of the electronic locks.
yes.
And anyway, they said they've had a work order on for 2 months now and nothing's been done. So if you could look into that. The other was I know we've kind of talked about the housekeeping there at Hastings. My mother's in there quite a bit, and she said that it's just the restrooms and the elevator doors are always nasty, grungy looking, fingerprints and so forth. And I don't know, that's a housekeeping crew, but if you could relay that message. And then the other thing regarding the pharmacy is when you had to call in your meds, like my mother was calling, like almost starker calling the pharmacy just back to back, and she could never get through. And then I got other people saying the same thing. So I talked to Councilman Byrd, and he said, well, why don't you call the number yourself? So I called, and the same thing happened. We couldn't reach anybody. And is it effective, the calling the meds? Have you guys experienced some problems? If you haven't heard the problems, or if you, I guess if you're aware of the problems, you guys got the solutions for them, or?
This is the first complaint I've had on
Really?
pharmacy
Okay.
since, seriously, in the last
Okay.
few months. Jeff?
Yeah, Dave, I haven't had any problems actually anymore. Our phones aren't just constantly ringing, and I've got dedicated staff to answer them. Now, were they trying to use the IVR system? Because we've had some problems with the automated voice response system and cell phones. But just calling and physically talking to a person?
Yes, yeah.
No, I haven't, honestly, I haven't had any complaints in a while.
Okay.
We seem to be doing a better job, and if not, I'll readdress it.
Well, I'll bring them to you then today.
If you can call us at the time it's occurring, that would really be helpful too, because then we can do troubleshooting right then.
Okay,
Yeah, if you want to just text me or something, Dave, when that happens, let me know.
okay,
Then
sure
I'll
thing,
make
yeah.
sure you have my right number.
I just want to bring to y'all's attention, because
Okay.
we want a good quality service to our people.
We do too.
So, yeah.
Appreciate it.
But anyways, that's all I have. All right, thank you, Connie. Thank you.
Okay. Counselor Byrd?
Yes, when I received a call from Counselor Walking-Stick about the restroom issue, I called Dr. Doug Nolan, and they took care of it that afternoon.
Okay.
So
Yeah, that's right.
that was addressed.
And I know Brian Hill's in the back, and he's probably already texted Ronnie Hendricks and Dale Water, and
Yeah.
those things will be resolved by the end of the day,
Yeah.
I'm sure.
Yeah.
Okay. Counselor Thornton?
Yes, we've received this text saying that we partnered with Talcott City. Well, what kind of partnering are we doing with Talcott City?
There are no new partnerships. There are no new partnerships outside of what we've already been a partner with.
So we've been a partner with them for quite a while.
Yes, I guess since 2009, I believe, there was a relationship developed with Tahlequah City through Cherokee Health Partners, where we share now services to do radiology services, nuclear stress tests, those types of things, imaging.
I've got a lady that, Three Rivers, and she's got a bad hip. It's very bad. She's been taking shots for it for about several years, once every 3 months. Can't hardly walk. So Three Rivers referred her to orthopedic center because happened to be Dr. Mattel. He comes back and says that she needs a total hip replacement. So they send her to a Tahlequah, I guess, or Three Rivers, give her MRI. Doctor over at W.W. Hastings said there wasn't anything wrong with her. She looks great. And she's been denied to go to Mattel. So the thing is, you know, she's got Medicare, Medicaid, and they pay so much of it. And I think it would cost us like $2,000 to do her operation. And I can't figure out, you know, if we're going to send those people to these specialists, and if I was having my hip operated on or my knee, it'd be Dr. Mattel. Because he's one of the best in the world, I think.
That's what I've heard.
And I don't see her coming over here to go to Tahlequah City to be operated on. Because it's going to cost us the same thing.
We don't have a partnership with the orthopedics there. We contract a lot with Dr. Chris DeLoach, so that wouldn't be anything related to any kind of partnership. But if you can give me her name afterwards, then we can go back.
I've sent it all to you.
To who?
Health Department. Y'all. You know, I've been through this with my son. My son had real bad knees. And then he got his foot hurt. Went over here to Tahlequah, and there wasn't nothing wrong with it. Of course, it swelled up this big around, and it still hurts him every once in a while. Well, it took us 3 months to get a referral to go see Dr. Mattel. So went and got one, then came back. Took us another couple of months to get a MRI run and sent to him. And then we couldn't get another referral to go see him, even to go see him. So he just went up there and went and saw him on his own. And Dr. Mattel told him he needed knee surgery on his left knee and so forth. So he went in to his knee without a referral from Hastings. Repaired his inner and outer meniscus. He can walk pretty good now. He couldn't walk hardly at all before. And he's went through that for months and months. And we couldn't get anything done. The only one that do anything is Brett Hayes. And he had to run the referral down because he couldn't find any of it. And he's done that 2 or 3 times. And something's got to give here. Because if you got to go get a referral, go see the doctor, then you come back, and you got to get a referral to have an MRI run, and then you come back, and then you have to have a referral to go see the doctor again, and then you come back, and then whatever the doctor says he'll do, then you get a referral to go do that, but you're denied. Something's wrong here. It cost my son $77 to go to the doctor. So it wasn't no big thing with him. But it is big with these people that it's going to cost them $2,000. It's big. Because they don't have it to give. And somebody needs to look to see what's going on.
I agree, that's a process that we don't like because I feel like it takes up a lot of time in the clinics for our providers just to write a referral we know is going to come with that visit. And Sandy Hathcote, she's the senior director, you know Sandy, is working on streamlining a lot of that process right now. So I'm hoping in the next couple of months we'll have something to.
Well, is that a federal regulation that they've got to go back to?
I think it's a policy that's in place.
What kind of policy?
It's to help control spending, to be quite honestly, because
Whose policy is it?
contract health,
Then it's our policy.
yes.
Okay. Thank you.
Councilman Bezard?
Yeah. Connie, are we going to be seeing less referrals out for contract health for this remainder of this fiscal year?
Well, I anticipate that we will see, because the practice has been, a lot of referrals go out for things that we can do in our own health centers. And it's gotten our spending out of control in contract health. And so we've asked our docs to do a better job managing patients within our own health centers and not sending them out for things like knee injections and shoulder injections, casting, a lot of things. So we've asked them to manage that a little better,
Good in-house.
if we can.
The other thing, at the J Clinic, I just noticed the numbers on the, numbers way up, over 11,000, so I guess people are checking out the new clinic there, and people are certainly happy with the new clinic. I'm happy with it, and I think everybody that goes there is happy with it, so
Good.
we want to pay those compliments to you in the health department. and
Well, thank you.
Administrative staff here. But I do have a comment or a question about dental. I see Dr. Jones is here. I'm just reading the report, and I had some people that call me because we used to do community dentistry there at the J office, and they would get these kids from Head Start centers. They would go to schools and get fourth graders in and bring them in to get sealants on their teeth,
Yes.
which I thought was really good because it's preventive type of thing for the kids. But what I'm understanding, what I'm hearing from the community is that we're not doing that anymore. And then I just read in here that we have a team that travels to clinics without dental clinic to do screening and facilitate patients' access. They also coordinate education services and community meetings, but these people are saying they're not coming out there.
They do that, and I did
Well, I
not.
checked with Jay School, and they said they haven't had it sent anybody down there for sealants.
Okay.
I don't know.
Dr. Jones, do you have a schedule?
I don't know what the schedule is, but we do have all the schools that we've seen, and we're adding to that every year. We do have a team that goes out to schools, they do second grade and under.
Yeah.
So anybody above the, we can't do the whole squad. It's
Right, I understand that.
community events where we do education.
Mhm.
But as far as the sealants and the fluoride treatments, we do second grade and down.
Okay, well, that's what they were calling it. If you don't mind, Dr. Jones, send me that schedule, will you, so I'll have an answer for people that do that to me.
And maybe,
Dr. Speed and the team coordinate that.
Okay.
They work with the superintendents of each school to find out when the best time is to come.
Sure.
And then sometimes, depending on how testing goes and things like that, things get moved around. But typically, they work with the superintendent of each school to coordinate those events.
Okay, well, that's fine. If you just send me that schedule, I'll have an answer for those people that ask me that.
maybe we can include the schools that are covered in the
Good,
next
that'd
month's
be right,
report,
that's-
so you guys have an idea
Yeah,
where
just
they're
send it to us. Okay, that's all. Thank you, Madam Chair.
Okay, Counselor Thornton?
Yes, I've got another one that needs to be kind of looked into, and I've sent y'all all the information on it through our aides up here. And he's got a rotator cuff, or what you want to call it, on his shoulder that's bad. And he was laid off work 4 months ago. He's been trying to get a referral to get it fixed, and he's being denied. If he don't get that thing fixed, he don't have a job. You know, he's got to go back to work. So, appreciate you looking into him.
Sure
also.
will.
Any other questions? Counselor Lake?
Thank you. These referrals that are being, and we've all got some, I think, being denied or delayed. Is that because we can't do third-party billing with the new system, or what are we looking at?
No. Brett, you have your documents. You know, our health system has grown tremendously, over 10% by volume every year that I've been here, and I think before that. And we've budgeted a flat budget with contract health all these years. And so it's obvious that once, there's at some point, we're gonna have to slow some of that.
And, I mean, we've given you the 5% program, and it's added, I forget how many $1 million a year
About $6 million, I believe,
to the program.
yes.
And I guess, a lot of where I come from, we have to jump through 2 hoops to get care. And you guys know this, but I'll explain it one more time. If we get denied or delayed at Claremore, usually denied. Then if they're Cherokee citizens, we've got to come and ask Brett, usually we call, or somebody calls, but not me all the time. if I get one call, I bet there's 10 or 15 on me out there that gets it. I don't know that. And so we try to work the system that way. So it seems if you're gonna cut back on these referrals being denied, my people are taking a bigger hit than the rest of the nation is. And I'm not seeing a fairness throughout the jurisdiction. Oh, thank you. And so my question is, it appears to me that your new system may not be totally, fully 100% operational. I keep hearing it from you every now and then, but I didn't know if it was third-party help or what we're looking at.
The issue is we have overspent our contract health budget every year that I've been here by anywhere from $5 to $10 million, and we've always had carryover that covered that. And we just don't have that much because we're spending so much and we're adding the number of patients at such a rapid speed right now, it can't keep up right now.
Well, that has to do with planning on your end, I would think. So here's, if you've got, how many open positions do you have in 277?
I'm sorry, I didn't hear
Do you
you.
have 277 open positions in health?
I believe in total staffing,
And so, in dollar amounts, how much would that be? Anybody have a guess?
I wouldn't know off the top of my head, sir.
Anyway, but I think, you know, we got the, I don't know what happened to the $29 million litigation cost that came back to us. Did that go to gen fund or the health gen fund or?
I'm not sure where,
That was a couple of years ago. Year and a half ago.
I know what you're speaking of.
Okay, thank you. If, somebody needs to look into that. I'm getting calls and Brett knows I'm getting them and we're getting denied. And if they're Cherokee citizens, I ask if we can send them to telephone because you guys get 97% referral rate figured out. And now I'm hearing from David that apparently we're not getting that either, David Thornton. And so it concerns me. That's why I'm asking. Thank you.
Well, I think this information is kind of the first thing we talked about our medical priorities. When I came here in '04, we had 27 different categories and it was a lot of minutia. We then, the medical directors at the time, jumped us down to 7, which was a little compressed, made it more logical. And now we're down to really these 3, which is easier to think about. It's things we do automatically, things we want to look at, and then things that we just don't do. That's the first page. That covers about everything we can look at. This volume, I started this spreadsheet when I was in Jody's office in October of '04. And this was all cubicles in here. But, so I've had this thing going for that long, and it's a good thing to look at from a longitudinal thing. So our referral volume it's a good problem to have, I guess, because we really do a lot more stuff for people. We do things now that we just didn't do in the early 2000s. But we've increased the approved referrals, we've increased 630% since '04. And I don't think our medical staff has increased that much. So we've just added more things. We never did pain management, a lot of orthopedics. It's a lot of stuff. And so we've created this kind of a benefit package. We've got a lot of healthier people. But it's, every 2 to 3 years we have physicians and say, can we, we slow down on this or, ease up on that. So we're just, they're trying to take care of the patients, and it's just, we've really, like she said, I can't recall a time that we've not really overspent. My first year here, I was like, what's that big stack of papers in September? And they said, oh, that's what we're gonna obligate in October when we get money. And the care was already going out the door and the patients were getting taken care of. But we didn't do that anymore. But that was how we overspent then. So it's just a historical pattern. We've taken care of patients.
If we filled up with providers, wouldn't you have more billable hours,
Well,
billable patients?
Those are different. I think those are different buckets of funds. Because we looked at some numbers for every physician we add. Because like Muskogee Clinic came online, we had I could be wrong here, but we went from say 2 providers in that little strip mall to don't know how many are there, 10? We do the math that one new provider costs us $300,000 in new CHS referrals. So, like the Muskogee Clinic didn't come with any new CHS money. We had the same funding before that we had after. When we get the new joint venture here in Tahlequah, we're not going to get more CHS money. It's going to be the same pie. We're just going to have, we're going to attract more people. More patients are going to look at that and say, wow, I want to go there. And we're going to get insured patients, which really helps a lot. But we're going to get uninsured patients. We're going to get patients that, look at us as they don't need to get insurance because they have us. About once a month, be it a softball field, a soccer field, or somewhere, I stop and say, whoa, where do you live? I live here. Well, you're in this jurisdiction. You're in that jurisdiction. I feel like a preacher sometimes about insurance and county lines and all those things. So it's a challenge that we all share. It's our shared challenge.
I mean, if you've got a position, you can, if you're working it right, you can make money off that position or off that provider.
Mm-hmm.
It is a cost to us, but it's also a money-making opportunity.
Yes.
And the fact that we're only down 13 is surprising. That's good. Work it down.
On this sheet, the top pie chart is our facility, it's percentage of visits, and the second one is CHS spending. And you'll notice a variation there that really, a lot of it relates to payer mix. So, like, historically, J, we don't spend a lot of money in J. I think we've got a lot of Medicare and Medicaid patients there. And the Medicare referral will cost us, $25, where if somebody in, say, Muskogee, 50 years old doesn't have a payer source, that might cost us $120. So that's some explanations for the variation there. And historically, we spend more in the northern areas because in the past, we've not tried to make people come to Tahlequah for certain things. It just seems like, Bartlesville's a drive. Oh, you guys probably know that. It's another weather system, and sometimes to have somebody come down here for, a test or something, so we're trying to work hand in hand with George and his folks to do more stuff there.
Well, I keep putting those maps out. Bartlesville is in the Cherokee Nation.
It is.
That's the first thing when I got down there, they said, well, how could you be a counselor on the Cherokee Council, Bartlesville, and Washington counties, not in the Cherokee Nation? I hope we've gotten past that, but apparently not.
Oh, yeah, but I guess what I was saying, historically, those patients would get something that we might force into Hastings if it was a Southside patient. We'll send them to, Jane Phillips to do it there, or we'll send it, local. So.
Seems to me most of our folks you send to Tulsa when we can get a referral. I've talked to the health department about trying to
You try to do more Jane Phillips.
more things with Jane Phillips. I don't know what the situation is.
It's usually more physician-driven. So in my world, when I see a helicopter go over, I look up and say, there goes $8,000. I become cynical sometimes.
Thank you.
Counselor Walking-Stick.
Hey, are we taking these services away? Contract services?
We're adding.
Okay. I received the email from you guys saying that we're just cutting down.
We just went over that.
So I don't know if we wasn't going to take some of the services, or what was your intent behind the email?
Just to manage our patients a little better than we are. I think a lot of times the docs are in the clinics, we get a lot of referrals that are just inappropriate for contract health, and I don't have that list in front of me, but things that were not normally covered by contract health or shouldn't be, or that can be handled at a Hastings, instead of sending them outside of our service area, just manage those there. Casting, instead of sending them to somebody in Tulsa, let's cast those simple fractures in the office.
Okay. All right. Well, so in funding's the issue, right?
The growth of our health system is the issue. We're adding more patients
But
than
we don't have the funding to keep up with the increase.
I think if we manage our money better by managing our patients better, we're gonna be just fine.
Okay. Well, that was all I had. I think, Chair.
Councilor Byrd?
Yes, when I look at the referrals and the ones that were approved, and if you just go back 5 years, 44,000 referrals, 42,000 approved, and 1,900 denied. That's not bad, because, you know, we are expanding our services. Our tribe is growing. When we were in Wiley Hall back in 1979, some of you guys weren't around here, I'm a little bit older than most of you, we had 25,000 tribal members. We encouraged all employees to get insurance when you're employed by the Cherokee Nation. One thing we might do is encourage that again. When we employ someone, you know, see if they will take on insurance, because the health care we have now is just a supplemental care. Okay? I come from the most poverty-stricken area, and I'll compare that with anybody here. But I encourage all my kids to get insurance, and all my family members to get insurance. Hastings doesn't cover everything that we need. But I don't want to get in the same shape as the state of Oklahoma either.
No.
And not be able to take care of our budget. And our numbers are growing. We do need to approve more of these referrals. We sure don't want to be like the federal government and look at their budget. So do the best you can, expedite some of these referrals, but do not get us in the red.
Yes, sir.
Okay? Thank you.
Connie, I just wanted to ask, how, are we still backlogged on third-party billing? Are we getting caught up on that, or?
We are about 6 weeks behind on our coding and billing. We're getting some help with that through an outside vendor.
Okay, that's great.
Making progress.
I also wanted to comment on Dr. Lewis. I seen the Facebook post, and so very proud of him. He is a wonderful doctor. I mean, he is, and just a wonderful person overall, and I just want to say thank you to him.
Oh, no kidding. That was an awesome thing.
And if y'all didn't see it, check Facebook or read the Tahlequah newspaper. Any other questions?
Let's move on.
Let's move on to old business. There's none pending. New business, none pending. Announcements. Next meeting is June 13th at 1 o'clock. Any other announcements? I do have one. They are having a proclamation signing at 2 o'clock at the front of the complex for the foster care. They would like for all of the council to attend and then hurry back down here for our next meeting. Motion to adjourn? Second. All in favor?